This is an informative speech by Alison Presutti.
The room is bright, but the mood is dark. She's 56 years old, barely graying, soon-to-be grandmother who's been diagnosed with stage 3 breast cancer. The doctors are optimistic. Once the radiation is completed, she'll be scheduled for a mastectomy and pray the cancer hasn't spread to other parts of her body. She's hit with a wave of nausea as she climbs onto the radiation table. Part of the job of a radiation therapist is to make patients more comfortable during radiation treatment. Being radiated is probably one of the most difficult things you'll have to go through because it's painful and you're being exposed to radiation. What exactly is radiation therapist, and what is a career as a radiation therapist like? A radiation therapist is a health professional who works in the field of radiation oncology and delivers radiation to cancer patients. However, in practice, there's so much more than that. Radiation therapy uses high doses of radiation to kill cancer cells and shrink tumors. This reduces the recurrence rate and makes tumors smaller so they're more amenable to surgery. Half of all cancer patients receive some kind of radiation during their treatment. This can be before or after surgery, depending on the kind of cancer. Cancer cells can't repair themselves like other healthy cells, so once they're killed, that's it. Unfortunately, some of the healthy cells are killed at the same time. There are 3 basic types of radiation therapy. External beam radiation therapy is delivered to the outside of the body. First, a tattoo marks the spot to be radiated, and then a machine called a linear accelerator is used to deliver radiation. It moves around the outside of your body and doesn't touch you. Internal radiation, called brachytherapy, uses seeds inside your body and is most commonly used in prostate cancer. Marmocyte is another type of radiation therapy that's used on the inside. The seeds are put in through a catheter into a balloon, and it's only 5 days instead of 5 to 7 weeks. There's also systemic therapy, which is in the form of pills or oral liquid or IV radiation. As with most cancers, there's side effects. Some side effects are right away, like hair loss, nausea, vomiting, and skin rashes. Other side effects occur later, as often as 6 months after you finish radiation therapy, and these can be memory loss, heart problems, liver damage. And individual side effects depends on your age, the health problems before you started treatment, and the dosage of radiation that you're receiving. Once you've decided that radiation therapy is a job for you, the education requirements are an associate's degree or a bachelor's degree. Most employers require that you have certification with the American Registry of Radiologic Technologists. There's also ongoing and continuing education to think about to keep up with changes in radiation. Just in the last 5 years, there's been a lot of updates in radiation therapy, including proton therapy, which allows for higher dosages and less treatments, and computerized simulation, which helps in treatment planning. You, of course, want to know what kind of salary you can expect. Starting salary is around $62,000 when you first get out of school. And once you have some experience, you can make anywhere between $72,000 and $80,000. Fortunately, the expected growth rate in radiation therapy for jobs through 2015 is 20% higher than the national average. Often students don't consider what kind of day-to-day job requirements there will be. Hospitals might require longer hours for less pay, but be more flexible and give you more benefits. To consider becoming a radiation therapist, you really need to be an outgoing person. You're going to be dealing with patients all day, with doctors. You need to be able to talk to them easily. Being physically fit helps so that you can help patients on and off the table and be able to move the radiation equipment around. You have to have good attention to detail so that you're not making errors in dosage amount or the area to be radiated. You'll be communicating with the treating oncologist and letting them know how the patient's doing and basically how their therapy is going and how they're dealing with side effects. By simply listening to patients, reaching out to them, and being sympathetic, a radiation therapist can offer a lot of comfort to a patient. The salary potential is exciting, and being part of a cancer care team is rewarding. I'm looking forward to a career in radiation therapy, I think it'll be emotionally rewarding and something that I can do for a long time in the future.